So in terms of the monitoring, I guess this is where the foundation comes into its own. So we're a charitable trust funded by the Ministry of Health to provide a monitoring program. We want to work with primary care. We know primary care have a vast amount of things on their plate to juggle, and we want to work with primary care to assist with the monitoring of this specific condition. So what we do is, for all the patients enrolled in our service, we send them out 6 monthly blood forms, and that includes the LFTs, the AFP, and that's one I haven't mentioned before. It's the alpha fetoprotein, which is a liver cancer blood test. It's effectively a tumour marker, and also the surface antigen and some of the other serology blood tests, just to confirm that they have ongoing active hepatitis. And we do that 6 monthly. From age 40, we add in a couple of additional tests. The full blood count we do once a year, and the reason we do a full blood count is quite specific to the liver. And this is a whole nother talk in itself, but I'll just throw this in here. When a person has developed cirrhosis of their liver, one of the ways we can see that the cirrhosis is progressing and they're getting more damage is when their platelets start falling. And you'd be like, well, why? What's the link between the liver and the platelets? But it relates to the plumbing in the abdomen, and as the scar tissue increases, the spleen gets enlarged because of the back pressures, and they get a fall in their platelets. So we want to be watching for someone who's got Hep B and their platelets are falling. That would prompt us to go, we need to do an ultrasound to see whether they've got established cirrhosis. So that's why we do the full blood count. And also from age 40, we are now, even if that person has had normal liver blood tests, we are doing viral loads, one off, and then depending on how high it is, we might repeat it again in a year or two, just to take that into account in terms of that treatment decision.